Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Let's look into the dopamine and the dose dependent action. So to begin with, the first one is the low dose. The low dose means the infusion rate is less than 2. So less than 2. So the effect is it involves the D1 and D2 stimulation and it increases the renal blood flow. So it includes the renal blood flow, RBF. It increases as well as the urine output. Next is the category of medium. The medium means it is about 2 to 5 mcg per km per minute, and the effect is it is again the beta 1, the beta 1 stimulation, and it includes the additional cardiac stimulation. Then comes the dose of high. The dose high, the infusion rate is 5 to 15. The effect is alpha. The effect will be alpha stimulation. This is the alpha 1 stimulation, and there is a vasoconstriction and the increase in the blood pressure. There will be vasoconstriction with increase in the BP. To learn and grow daily like this, please do subscribe.